After undergoing any surgery, if we are normal immediately after that, we are always happy. But few weeks or months later, symptoms can come in that portion where surgery was done. Then that will cause a real worry for anybody. Welcome back to Ophthalmology for undergraduates and postgraduate beginners. Today I am going to talk about late postoperative complications of cataract surgery. Following cataract surgery, the patient will be happy and absolutely normal for few weeks, that is up to 4 weeks. After 4 weeks, he may develop certain symptoms in the operated eye that will cause a worry for him. Let us see what are the complications that can develop 4 weeks after undergoing a cataract surgery. The commonest late postoperative complication we come across is after cataract, otherwise called as posterior capsular opacification. Patient will be absolutely normal after a cataract surgery. He will be having very good vision, but over a period of few months, patient's vision slowly decreases. Patient becomes unhappy and comes back to meet the operating surgeon. That time when you examine the patient, you can see the posterior capsule appearing whitish in color behind the intraocular lens. Here, just for a contrast, I have drawn that in red color. Why such a thing occurs? You can see here, this is the capsular bag where the intraocular lens is placed. The anterior capsule is open, the posterior capsule is intact. I have drawn multiple red colored cells near the equator of the capsule. These capsules having the epithelium, this is called as the epithelium of the capsule, they are still active and they can still form the lens fibers. So what this epithelial cells they do is, they form the lens fibers. So the lens fibers will once again form like this behind the IOL. They cannot form in front because it is open. So they always grow along the capsule. So they grow along this posterior capsule. But because the anterior capsule is open, the aqueous humor can freely go into the capsular bag. So what happens is, these newly formed fibers, they take the excess amount of water into them and they become opacified. Over a period of few months, many fibers will be formed and all these fibers gets opacified, leading to a thick opacity in the posterior capsule. That will affect the entry of light into the eye. So this is called as after cataract or posterior capsular opacification. This is the failed attempt by the capsular epithelium to reform the lens. So that is what is called as after cataract. If such a thing comes, it is very easy to treat them. How to treat them? We can treat them using lasers. So we have a laser called as ND-YAG laser, neodymium, yttrium, aluminum, garnet laser. So we can apply the laser. Here and we can open this opacity like this. We can create an opening in the opacity like this. Once again, the light can freely enter into the eye and give back good vision. After cataract or posterior capsular opacification is of two types. One is sommering ring. In this picture you can see the capsular bag, unlike the bag here, has collapsed. It has contracted. The IOL is touching the posterior capsule. If the epithelium tries to form the new fibers, those fibers cannot go between this IOL and the posterior capsule. So they remain outside this IOL and the posterior capsular contact area, that is only in the periphery. So these fibers in the periphery, they get opacified, leading to a ring-shaped opacity like this. So the posterior capsular opacification is more in the periphery and less in the center. So that is called a sommering ring. This will not affect the vision like the second type, that is the L-stick pearl. In the L-stick pearl, you can see that the capsular bag is well open. The IOL is not in contact with the posterior capsule. So the fibers go here behind the IOL and in between the IOL and capsular bag. They get collected there. They get opacified. So these opacities will resemble a bunch of grey colored grapes. So this is called as L-stick pearl. Because this opacity is in the center, this will affect the vision more than the other type. The second most commonest late postoperative complication we come across is cystoid macular edema. This may be due to an inflammatory reaction caused by the artificial lens implanted into the eye, or maybe due to the drugs used inside the eye during the surgery that can lead to a edema in the macula of the retina. This may also be due to certain associated problems in the patient like diabetic retinopathy, retinitis pigmentosa, Irwin gas syndrome. All these things can also trigger this cystoid macular edema. Cystoid macular edema usually develops few months after cataract surgery. This is collection of fluid between the outer plexiform layer of the retina and the inner nuclear layer. There the water gets collected. You can see here there are cystic collection of water drawn in blue color. So that will lead to a macular edema, that is called a cystoid macular edema. When you do a fundus fluorescein angiography, you can see a flower petal pattern. You can do a optical coherence tomography to appreciate this cystoid collection of fluid in the retina. Usually this condition is self-limiting, but we have to give the patient topical non-steroidal anti-inflammatory drugs immediately following the surgery for few months time to prevent this as a prophylaxis. We can also give systemic NSAIDs to reduce this swelling. If it is not responding to non-steroidal anti-inflammatory drugs, we can always try with systemic steroids. Or we can give injection of steroid in the subtenon space. All these things will try to reduce this edema and give back good vision to the patient. In cystoid macular edema, when you do a ophthalmoscopy, the foveal reflex will be absent. The fovea or the macula will appear irregular in its contour. That is how we identify with an ophthalmoscope. Even though this complication is very, very rare, but still we see this. The third complication is retinal detachment, which can occur after a long time the surgery has been completed. Here in this picture you can see the retina has separated from the choroid. So this is called as retinal detachment. Usually this retinal detachment occurs whenever there was a vitreous prolapse during a cataract surgery. Because of the discontinuity of the posterior capsule, the vitreous can come in front. So what will happen is the amount of vitreous will get reduced. We know that the vitreous is there inside the eye to keep the retina attached to the choroid. Now, because the vitreous has got disturbed and the amount of vitreous has reduced, the vitreous remaining in the eye does not act as a tamponade for keeping the retina attached to the choroid. Moreover, the vitreous is also tightly attached to some portions of the retina. So, a loose vitreous body will move and exert traction on the retina at certain points. Sometimes it may pull the retina from its attachment, leading to retinal detachment. This is also very common in patients with high myopia or pathological myopia. This complication may occur very, very late, but the infective organism will enter at the time of surgery. It is because of the incubation period that is very, very long in this organism. This late postoperative endophthalmitis occurs very much later in life after undergoing a cataract surgery. The common organisms which can lead to a very much delayed postoperative endophthalmitis leading to reduced vision or blindnesses, Propionibacterium acnes or fungus infection. These organisms, they take a very long time to grow, so endophthalmitis can get delayed. So, while doing any cataract surgery, utmost precaution should be taken to avoid any infection that time itself. In that way, this complication can be prevented. With this, I am stopping the complications of cataract surgeries. There are so many complications, but I have highlighted only 10 of them in the past 3 videos in detail. So, we will talk about some other topic in the next session. Thank you.